Welcome to Variations 4, the Hematology unit. In this video, we'll cover questions 1 to 5 from the itinerary. But before we get into that, let's talk about 3 overall issues we're going to talk about. We're going to talk about a few different hematological problems in this unit. You could classify each problem we're about to talk about in this unit into one or more of 3 categories. What are the 3 main issues, hematologically speaking? You'll find by the end of this unit that each problem has some combination of one of these 3 things. Either too many of whatever blood product we're talking about, whether it's platelets, RBCs, or WBCs, or all 3. Too many in circulation, or you'll find too few of them in circulation, or you'll find dysfunctional components of them, and sometimes a combination. Let me give you an example. Anemia falls into which one of these categories? That's right, too few in circulation. Anemia is too few red blood cells in circulation. How about leukemia? What does that fall under? Well, that falls into too many in circulation, because in leukemia you have too many white blood cells in circulation. But it also falls under dysfunctional components in the sense that these white blood cells are immature, and so they're not doing their function, not able to defend the body. And you could also throw in too few in circulation, because this proliferation of white blood cells can crowd out the bone marrow and cause diminished amounts of other products, such as red blood cells and platelets in circulation. Now, we'll look at all that later on. This is just a warm-up discussion, so that I challenge you that you take each topic we talk about and try to fit it into one or more of these overarching categories. This helps keep the concepts clear on what we're talking about today. So the first question then is, what are the components of blood? What percent of that is water? There's your components of blood. You can see that more than half of it is plasma, and most of that is water. So almost half of a circulating fluid in our body is water. Anemia refers specifically to red blood cells, of course, which also involves hemoglobin and hematocrit values. That answers number 2. Causes of anemia, we can look at our PowerPoint for that and just get a quick summary here. We've got dietary causes, we've got renal causes, you've got iron stores and liver issue, hepatic causes. Of course, there's hemorrhage, blood loss, and just generally increased red blood cell destruction, which we're going to go through a few of these in this class. Number 3, describe in one sentence the physiological abnormality associated with thalassemia. Signs and symptoms and treatments. Go to map number 1 for that. Thalassemia, your issue is abnormal hemoglobin. Okay, it's genetic in cause, and the issue with it is this. So the abnormal hemoglobin is causing the red blood cell to basically self-destruct. And so you get a drop in hemoglobin and you get a drop in hematocrit. You get a drop in RBCs. If this is a minor thing, as you know, the body reproduces red blood cells, then the body can adapt. If it's a major issue, then you might need some blood transfusions. They might need to get the spleen removed because the spleen plays a role in removing red blood cells from circulation. But splenectomies, as we talked about in another video in this course, are rare because they compromise the immune system. Bone marrow transplant can change the course of things. This can change the red blood cells that are produced. A bone marrow transplant can result in healthy blood cells being produced. In any case, while this problem is happening, you're going to have cell debris getting jammed up in kidneys. You'll need IV fluids to flush out the kidneys. Of course, with increased hemolysis comes jaundice with the bilirubin. So question 4 and 5 is really asking about aplastic anemia. Let's talk a little bit about that by looking at the maps here. So just minimize this, and we'll take a look at the maps here for aplastic anemia. So aplastic anemia can be caused by a few things. It can be genetic, it could be from drugs or radiation, but it ends up in pancytopenia, and that is pan means all around. That's what pan means. Cytopenia means decreased in cells. We're talking about decrease in all three cells, RBCs, WBCs, and platelets. So obviously, if you think about what are the risks for each of these things, well, if you have a decrease in platelets, you've got hemorrhage risks. If you got a decrease in WBCs, you've got infection risks. A decrease in RBCs, you've got all the signs and symptoms of problems that come with anemia. What can we do about these things? Well, we have to stimulate the production of these cells in some ways. We've got neupogen for white blood cell growth, erythropoietin hormone for RBC growth, blood transfusions. Of course, a bone marrow transplant, if we can get one, could solve all our problems. And immunosuppressants, if the cause is secondary to an immune response. So in terms of this pancytopenia, if we look at the little head-to-toe diagram, it should be pretty self-explanatory. If you're thinking about anemia here, you're thinking about anemia, decreased blood volume. You're thinking about reverse isolation if they're neutropenic from decreased white blood cells. All this lab work should make sense based on what we've talked about above. Here's compensation and the problem of anemia. And of course, if we have decreased circulation, then all these make sense too.